ProSites Showcase. So thanks again for attending ProSites Showcase webinar. Our topic today is this really exciting new solution we are introducing to help dental practices increase case acceptance rates. And I'm going to talk at a high level about the solution, and then I'm going to show you a little bit, hopefully try to show the solution to you so that you can see how this can be a benefit to your practice. My name is Keith Washington. I'm the VP of Products here at ProSites, and our goal at ProSites is to help our customers, our practices, be able to acquire new patients, engage their current patients, and retain them, and grow the relationship that they have with their patients, all designed to help you increase your practice. So what is ProSites Showcase? Really, ProSites Showcase was a solution that we partnered with a number of different companies to develop to help patients understand and accept recommended treatment. All practices really thrive on being able to help patients with their oral health, especially patients that need complex treatment. And most dentists, and we have done this with surveys, have a case acceptance rate of just 50 to 70%, meaning that somewhere between half to 30% of the patients who you have in a chair and you recommend treatment to them don't accept your treatment. And the average revenue from a complex treatment case is about $1,500. So when you think about the number one problems in a dental practice, increasing case acceptance rates is a big issue. I talked to a practice the other day that said their case acceptance rate was under 50%, meaning that 60% of the patients that come in and are recommended treatment by the doctor or recommended treatment by the staff don't accept that treatment. And there's a number of reasons why patients don't accept treatment that is recommended by a dentist. It could be a number of things, and we found out through additional surveys and really understanding the whole the concept of case acceptance. But some of it is that they don't understand the cost. They're not sure about the cost. They don't trust that this is the treatment that's recommended. They don't even know what the treatment is and why they need it. What they really know is they may or may not be in pain. They know that they probably need something, but they either can't afford it, aren't sure about it, and are not clear about what they're supposed to be doing. And so a lot of times they decline or defer treatment. Showcase will allow your practice to demonstrate a patient's needs and the recommended treatment in an easy-to-use slideshow format, customized for each patient. So this isn't just, here's your treatment plan. It includes a bill and your codes, ADA codes for the treatment. But this is a way for you to be able to easily show a patient what they need to have. Here are some of the features, and it helps, and Showcase will help explain the benefits, the alternatives, and the cost for recommended treatment. And we do this in, first of all, an easy-to-use interface. One thing that a practice doesn't want to do is take up too much time in being able to put together a case or a slideshow for their patients. So this is really simple. It should only take 2 to 3 minutes once you get up and running to be able to produce a treatment or a case treatment plan for a given patient, including their options and recommendations. A slideshow style presenter, so you can walk a patient through the recommended alternatives on an iPad. You can do it on the screen that you have in the operatory, a number of different options. Also, you can save the presentation, you can print the presentation out, or you can send the presentation to the patient in your patient portal or in their patient portal, really giving you a number of options with which you can communicate to the patient the need for this particular treatment. It also gives you a number of different treatment presentation types, and I'll show you some of those so that you can decide what type of presentation you want to give to a patient. It could be you just want to give a hygiene presentation, or we've had a practice who's asked us to produce a welcome presentation for all of their patients so that the doctor can personalize their engagement with them. And I'll show you how easy it is for you to do that. Also, ShowCase includes over 50 built-in HD videos. They're really short videos to help explain the treatment. One-page treatment education pages. So think of a video on an education page so that you can explain to the patient or give them some educational material, for instance, about implants or about crowns, and really help them understand what it is that you're trying to communicate to them and why you're trying to give them this treatment. It also comes with e-consent forms so that you can get signed consents right at the dental chair. And for ProSites customers who already know this, it also includes our online patient portal and forms so that you can provide critical information to the practice as part of their assessment. I won't talk a lot about online patient forms, but we have found our solution, and lots of companies have online patient forms, but our solution is unique in that it not only allows a patient to fill in form information or health history information, medical information, insurance information in advance of an appointment, but also provides the practice and especially the doctor with critical care diagnostic information before they see a patient. So if a patient has a history of diabetes, we'll provide that information in the portal, or in the dashboard and in the printout that's given to the doctor before they see the patient, and really provides a value add for the practice. What are the benefits? I think you'll be able to see that in my demo, but there are a number of benefits in using ShowCase. And here are some of them. Number one, you'll increase case acceptance. So imagine if you can increase your case acceptance rate by 50%. So if you're losing 4 patients every month, imagine the cost of 4 patients every month out of your total treatment plans who don't accept those treatments. What if only 2 more of them decided to accept treatment because you showed them the benefits, the alternatives, and your recommendation and how to pay for them and all payment options for a patient? That has a dramatic increase not only on case acceptance rates, but on practice revenue. A number of things that we do at ProSites provide value in getting new patients or helping patients stay engaged. ShowCase helps a practice directly increase their revenue. It also will save you time in explaining your case presentation or your particular case to them, so you as a doctor don't necessarily have to do the presentation. The dental hygienist can do it, or the front office person, or the dental assistant, because it is so easy to explain and use. We have practices that put together a presentation for every patient, and the patients are really happy with the care that the practice is showing to them. It reduces patient indecision. Too often, a dentist really believes, and we've asked them about this, really believes you need this, you need a crown, or you need an implant, or you need an extraction, and you just need it, and I can do it. Well, patients have a lot of stress when it comes to complex dental procedures, so this helps explain and reduce their indecision. It also protects your practice and helps you meet legal requirements with a digital record of your recommendation. So when you make a recommendation, rather than just having a treatment plan or that comes out of your practice management system, your recommendation to that practice, to that patient, shows up in a digital record, and you can store that information in your practice management system. And this helps ultimately build trust with patients, helps them understand the benefits, the alternatives, and risks of not completing recommended treatment. And so this really improves the level of engagement that you can have with a patient without taking up too much of your time. So I'm going to show you ShowCase and how easy it is to use. If you just give me a second to switch my screen. So this is my dashboard, my console for all of the things that I do for my patients when it comes to online patient forms and now ShowCase. And so I'm going to go to my patient list and imagine that a patient has come in and they've complained about some issues that they're having or noted in their health history form or the medical or the dental history form that they have some issues. and it's communicated that to you. And so now you are going to create a case for them. So I'm going to go in to Claudine, and I'll show you really quickly that Claudine has already filled out her patient information, including her date of birth, name. She's completed her responsible party information, her dental insurance information. That's really important. She's completed her medical history and her dental history information. And now you have done an exam, and we are going to complete the exam forms. And you have 4 different exam forms that you can choose from. One is a problem focus exam, or you can do one of 3 comprehensive exams, quick, standard, and precise. I'm going to take a look at the quick exam information, and all of the information that is stored or that you have to select in this exam form is built on the SOAP protocol, so that you can easily walk through the information that you need for a patient, and you never have to fill out information that's not relevant. You only have to check boxes that or enter information that's relevant to the patient. So first of all, I tell you what my diagnostic aids were. So in this case, the dentist used a dental probe. I looked at the patient history and did a visual exam. And then you look at the extra oral exam information. And for this case, when you did a head and neck check, it defaults to within normal limits. And so you don't have to do anything to any of these, including extraoral, intraoral exam. On their teeth, they had non-restored caries and a fractured tooth. And all of this information is important as it builds up the presentation and provides the recommendations for you. And on the periodontum, they had gingival recession and gingivitis, and all you had to do is check these 2. And this is information that you already are communicating to your staff as they fill out the treatment plan. The x-rays found caries, and so all I have to do is submit form. That's the exam form. It's that quick to be able to do that. And then I do the same thing for my recommendation forms, including the recommended dental care, the risks of no care, the alternative care, the recommendations, the cost of care, and the next steps. I'm just going to look at recommended dental care. So in this particular case, in this form is using the accompanies your CDT or ADA code treatment plans. But in this case, my initiating care is I'm going to give you antibiotics. I'm going to recommend pain medication. The recommendation you're going to give is an extraction and an implant, and scale and root planing, and some composite filling and crowns. And so these are really important. But notice that there are a number of different options for you to choose from, including cosmetic care, the estimated time to complete care, whether or not you're going to recommend sedation, and then preventive care, dental care treatment. All of these are easy to select if as you can see, even whether or not you're going to recommend a consultation. And once I complete all of this information, then I can create a presentation for Claudine. So in this case, I go to the presentations, and all of the presentations that I want have defaults for you already. You don't have presentations that you can choose from. In this case, I created the exam form, which was a comprehensive care exam. And so all I have to do is select the comprehensive care exam. And this is the default presentation that I have for this particular patient, including a cover page. Let's get started, what their main concerns were, what the comprehensive exam report said, a little bit of their medical history document, their medical history summary, and you'll see why that's important. The recommendation, the alternatives, the risks, the cost, the preventive dental recommendations, and next steps. And I can add a number of different education items to this. So for instance, I can add a caries video. and it becomes part of the presentation. I can also put in their treatment plan right into this presentation and show them what their treatment plan is, and they can save that information. I even had a doctor that asked, can I create my own video from my iPhone for that particular patient and put that in the presentation? And the answer is yes, because you can upload any file that you want and make it part of the presentation. It's that flexible so that you have a customized presentation for every patient, and you can do this in 2 minutes, or if you want to spend more time to build more customization, you can do that as well. So all I have to do is create the presentation. In this case, I've already done one for Claudine, and this is what I would walk through with Claudine after I've done my analysis, my subjective, my objective. Now this is, and then done an assessment, and here is the plan. And so it starts with, let me explain what your main concerns were. So when we showed this particular slide to dentists, a number of them said, this is great because too often patients don't think we're listening to them. And so here is what we heard from Claudine. And by the way, this first part of information she put in her health history form, that she said she wanted a cleaning and exam. She has some old fillings. She's having some pain in the lower part of her mouth. She doesn't like her smile. By the way, she's not afraid of dental care. That's important for you to know. What you learned during the interview and exam is that she had pain in her lower part of the mouth and pain on the right side. So now you're explaining to her, I understand what your concerns were, and now let me tell you what we found. And here is a record of what you found in the examination. Head and neck are within normal limits, intraoral within normal limits. Teeth decay was present and it's not restored. There was a fractured tooth. I see recession in the gums, gingivitis, and I found decay in the x-ray. Really important in being able to explain this to the patient. And now, here is what I'm going to recommend. First of all, I'm going to give you some antibiotics for the pain and a prescription, and I'm going to give that to you so that you can take it to your particular pharmacy. I'm going to recommend an extraction and a dental implant for that lower left tooth that's bothering you. I'm going to recommend scale and root planing because you have some gingivitis and some infection in your teeth. I'm going to recommend a composite restoration and a crown restoration, and I'm going to explain to you how to do that. It's going to take us 1 week to 2 weeks to do that, and then today we're going to clean your teeth and give you a fluoride office application. How simple that is to be able to explain this to the patient. And by the way, we suggest that you get this started. And you don't have to do it if you're the dentist, but anyone in your office can do this for you. Here, by the way, are some risks of not seeking care. And I want to make sure that it's important to you to know that if you don't take care of this, you're going to continue to advance in your decay. You're probably going to lose that tooth, and your tooth fracture is going to get worse. But, as you always tell them, I can save your teeth and stop the pain and infection if we do this together. There's some other paths you may take, and you can go a lot of ways with this, including I can just do the extraction or I can just give you the pain medication. But again, let's make sure that we take care of it. This is one of the most important slides in being able to talk to a patient about cost. Too often, we don't want to talk about cost, and then the patient knows they need it but aren't sure. So here are your estimated fees. Your insurance is going to cover 80% of it, so you're going to have to pay $780. I noticed that you have dental insurance. This is how we take payment, and you have a lot of flexibility in the presentations to talk about payment, including if you have a care credit application on your website, like our ProSites customers do, we can provide a link right to that care credit application so that the patient can fill out an application and perhaps get financing right away. Every dentist likes to talk about and make sure that we talk about preventing future problems, including how to reduce your risk, like using dental floss, a Sonicare system. the prognosis is good, and then the suggestions that you're providing. So this really helps if you have maybe you're dealing with a senior adult who needs younger child is taking care of them, and they want to get a record of what your suggestions and your recommendations are. We've also found this to be really important for pediatric dentistry if one parent brings the child and the other parent would like to know what happened or what they specifically said. As I talked about, we also include a number of different short videos. Um, And so you can see that these are high definition, really professionally designed videos that you can show the patient right there. If they say, well, explain to me a little bit more about implants. Well, here is a video on implants, and you can let them watch the video and find out if they have questions. You're doing everything that you need to do really quickly to be able to explain to the patient and show the patient what the benefits of the treatment are. And then you have a slide about next steps. Let's make an appointment. Don't forget to take your medication, and let's get the consent form signed right now. All of this took me about 3 minutes to complete for a given patient because the recommendations are clear for the doctor. If you have a patient or you have a practice in your office that you don't want to show the presentation there, or you don't, have an iPad or a computer in the operatory and you want to print it out, you can take this same information and produce the printed document for them, including here are your main concerns. Here is what we found. Here is our recommendation for you. And just as importantly, here are the risks of not seeking care, alternative care options, the cost of care, preventing future problems, and we've created the video in a one-page education tool so that you can show the patients. You can either use this as part of the presentation, or some people are using this separately, including dental implants and a number of different solutions that we have or pages that we have to help a patient make a decision and get them across the finish line. So you should be able to see that ShowCase is a powerful tool to help you increase your case acceptance rates. I just want to go back to the presentation to help you do a number of different things: increase case acceptance, increase your practice revenue, save time with these really easy to use tools, really protect your practice, reduce patient indecision, and build, I think really most importantly, build trust with patients who say, thank you for explaining to me what you saw and what I need to do. It's much more consistent. It's a wonderful process for being able to increase your practice revenue and improve the oral health of your patients. ShowCase really provides you with this customizable case presentation tool, and the normal cost for this solution that we believe is valuable in the market is about $500, $429 a month, and $500 setup. Just know that all you need for most practices is one new patient accepting a treatment plan a month to more than pay for itself. So we're not concerned about that. But right now, because this is a new solution, we wanted to get it out into the market. So we've created a $199 setup and only $199 per month for ShowCase to help you increase and demonstrate the value of your practice to a patient and increase your case acceptance rates. This requires no contracts. You can sign up today, pay the setup fee, and you can cancel it at any time. But we really believe that with just one more accepted treatment plan per month, ShowCase will more than pay for itself and potentially transform your practice. You don't want to have patients who come into your office, take up a chair space, and then decide they're going to shop around or they're going to hesitate or not take the treatment that you recommend. You want to build trust with your patients because you spent a lot of time and money in getting them into the office and then doing an analysis for them. Now you can help them be able to make the right decision. ProSites provides, as you know, hopefully you know, website design, search engine optimization, social media management. We show marketing, return on investment. We also have Practice Mojo to help our customers get automated patient notifications and reminders and email campaigns, especially now during benefit season. And now we have a tool that helps you directly in your practice increase case acceptance rate. I hope that this presentation really explains the value of this solution. I'm going to take a few minutes to take some questions. Again, this presentation and this has been recorded, so everyone will be able to get a copy of this presentation and get a copy of what we really believe is an exciting new tool to help you in your practice. I'll take questions offline now, and thank you for everyone who's attended.